About 10% of people have asthma. Diagnosis is simple. If typical signs appear, attacks are often sudden, dramatic. Symptoms include cough, especially at night or early morning, wheezing, which is noisy breathing, dyspnea or difficulty breathing, and chest tightness. When it is hard to take a deep breath, things get interesting when asthma doesn't follow the usual presentation. Around 30% of cases show no classical symptoms. Worse, about 50% of asthma cases remain undiagnosed. Without diagnosis, breathing worsens over time. Now, let's explore 7 signs of asthma outside the usual picture. The first is a dry, persistent cough. It's worse at night or early morning and comes without wheezing. This condition is called cough variant asthma. Many confuse it with other illnesses, but it's still asthma. The main idea is chronic cough. It can be daily or come and go, but it lasts for months. This isn't just occasional coughing. The person feels a tickling in their throat, which makes them want to cough. This cough may worsen with exercise, talking, nighttime, cold air, a common cold, or air conditioning in summer.
Almost 30% of chronic cough cases, after serious causes are ruled out, are due to cough variant asthma. In these cases, spirometry can be completely normal. This condition usually responds well to inhaled corticosteroids and bronchodilators. Treatment typically lasts 4 to 8 weeks.
Second sign is chest tightness without other symptoms. It feels like a squeezing sensation, a band tightening around the chest, or a heavy weight. It's harder to take a deep breath. There may be an ache or discomfort, not sharp pain, but a dull. Most people say they can't get a full, satisfying breath. Chest tightness is more common in adult-onset asthma. It may occur without other symptoms. Even in well-controlled asthma, chest tightness can happen occasionally. When chest tightness is more pronounced at night, it's a hallmark of undiagnosed asthma. It's one of the top symptoms to watch, even when no other symptoms are present. The third sign is when exercise or physical activity causes coughing or breathing discomfort. Physical activity may trigger breathing difficulties, often blamed on poor fitness instead of asthma. The cough is usually dry and hacking, like in cough variant asthma. It might start during exercise, but often worsens minutes or hours after stopping. Some people notice a repetitive dry cough only after running, playing sports, or heavy activity. Symptoms often improve with rest, especially after a few. Exercise in cold, dry air is a strong trigger. Chest tightness is common after physical activity and is known as exercise-induced asthma, EI.
A key feature of exercise-induced asthma is symptoms peaking after exercise, not during. Symptoms worsen 5 to 20 minutes after stopping exercise because airways keep narrowing. Usually, symptoms improve within 30 to 60 minutes of rest. This type of bronchoconstriction is very common in people with asthma. Surprisingly, it's also common in high-level athletes, especially endurance athletes. This happens due to high ventilation rates and exposure to cold, dry air. The fourth sign is recurrent bronchitis or respiratory infections. Asthma causes inflammation and mucus, increasing infection risks.
Infections worsen asthma, creating a vicious cycle. After a viral infection, the cough can last for weeks, even when the infection resolves. If someone has a history of eczema, allergic rhinitis, or a strong family history of allergies, those infections might actually be asthmatic flares. The fifth hidden sign is persistent throat clearing. This involves a frequent, often habitual urge to clear the throat, even with no or minimal mucus. Throat clearing or hoarseness can worsen after exposure to asthma triggers like allergens, cold air, or exercise. The sixth hidden sign is frequent deep breath. People may take deep, audible sighs more often than normal. These sighs often seem involuntary or out of context. It's linked to a sensation of not getting a full, satisfying breath even with deep breathing. This subjective feeling of not getting enough air can happen even when breathing rate and oxygen levels are normal. The seventh hidden sign is gastroesophageal reflux disease, and GERD commonly worsens asthma symptoms.